The case managers approach the provision of case-managed health and human services in a collaborative manner. Case managers work with professionals from within and across the healthcare organization. That includes the provider, payer sources, other community agencies, and other settings, and they collaborate closely for the benefit of the client and the client's support system. The primary function of the case manager is to advocate for their client and the client support system and coordinate care that's safe, timely, effective, efficient, equitable, and of course client-centered. These services are offered according to the client's benefits as stipulated in the client's health insurance plan, if the client has a health insurance plan. And the case management process is centered on the client and the client support system. We get to this point of resource management and service facilitation after having done the assessment work with the client and the client's significant others. We understand now what the client is asking for in the context of what they have experienced, what they have already tried, and we have learned what has worked for the client previously and what the client prefers now. As we share our knowledge of resources with the client, we may find we need to advocate on the client's behalf. We may need to model how to advocate so the client can develop the self-sufficiency skill. It is useful for each case manager to develop knowledge and a familiarity with resources available in the community. The agency case management program will have a listing, and each case manager is responsible for keeping that list of resources and referrals updated with contact information. Contacts frequently change over time, and it is not helpful for a fellow case manager to neglect to update that information when a person learns of a change. New resources develop all the time. It's imperative that the agency and all of the case managers keep the referral and resource list current. An important part of case management is referring clients in need of available resources in the community. Fraternal and religious organizations often offer a variety of resources ranging from building wheelchair ramps to food pantries. You'll want to keep track of these kinds of resources as well. The Area Agency on Aging and local public health departments have resources for elder care. Having meals delivered can help an elderly person stay independent and at home. Meals on Wheels Association of America is a national network of more than 5,000 senior nutrition programs that operate in all 50 states, delivering a nutritious meal to seniors. People on a limited income may have to choose between food and their medications. Nearly all communities have local food banks to provide nutritious food for needy members of the community. In addition, many local drugstores and grocery stores have programs that allow patients to refill their generic medications for free or at a nominal fee. Keep this information updated on your referral and community resources list. The next few slides are going to review again Social Security and Medicaid information. Take a look at the slides on your own time, as they will click forward after about 20 seconds. Doing for the client may be a part of helping the client access services on their own. During this time, case managers are raising the awareness of their clients to the behavioral health conditions. They continue their advocacy actions by doing for the client. This is important to prevent the client from experiencing unsafe situations or suboptimal care. It's also reflective of case managers representing those who are unable to represent themselves. An example is providing a client with information about NAMI and securing a schedule of meetings regardless of whether the client asked for such. Case managers may do for the client while educating them about their conditions and needs, clarifying situations with them, and simplifying what they may perceive as complex and vague. Throughout this stage, case managers maintain objectivity, refrain from disapproving or undesirable behaviors their clients may demonstrate, and intervene on behalf of the clients as warranted. As the client's skills develop, the case managers may find that linking their clients with professional guidance to assist them in resolving emotional problems and addressing the concerns and conflicts that may have arisen will also advocate for the client. The client will gain better understanding of where they are and acquire knowledge about their own behavioral health condition, about their fears and anxieties that they may be experiencing, and what type of support they value the most. As case management continues, doing together will occur. The case managers will assist clients in their attempts at taking care of their own behavioral health issues. For example, together the case manager and the client may practice taking the bus. The case manager may first demonstrate the behavior to the client and then ask the client to repeat it. And during their practice, the case manager imparts specific knowledge to the client, so the client begins to develop a level of comfort with the behavior and familiarity with the technical aspects of this kind of self-care. The client begins to move away from detachment and reluctance and more towards engagement and empowerment. Case managers use teachback to examine the client's degree of understanding and comfort with self-management and to determine areas for improvement and further emphasis. This ends the slideshow about community resources and important phone numbers. Take a look at the test and good luck.